We'll talk about another very important disease condition as related to blood, as related to newborns. So this is the HDN, and it's a hemolytic disease of the newborn. Hemolytic disease of the newborn. Okay, so just giving you guys a little gist. You just have to do it. The mother is rhesus negative, so the baby is rhesus positive because they inherited the rhesus positive stuff from the father. Do you understand? So this thing now led to some incompatibility, some conflicts between the blood of the baby and the blood of the mother. So it's also known as erythroblastosis fetalis. So it's a potential serious condition in which maternal antibodies attack fetal red blood cells, so it leads to hemolysis. Okay, so it occurs when the mother is sensitized to fetal red blood cell antigens. Okay, so she produces hemoglobin G that crosses the placenta, so the antibodies bind to fetal red blood cells and they cause the destruction of those fetal red blood cells. Okay, now common antigen system involved is the mother is rhesus negative, baby is rhesus positive, or sometimes the mother is blood group O while the baby is A or B. Okay, so sometimes you have the Kell, you have the Duffy, you have the Kid, there's some other minor blood group, okay, antigens. Alright, so issues that the baby will have while they are still in the womb: there's anemia, there's hydrops fetalis, there's intrauterine death. So sometimes you give birth to a baby and the baby is already dead. Okay, so after birth you have jaundice, you have pallor, you have large spleen, large liver, there's anemia, there's reticulocytosis. There's sometimes there's bilirubin to the level that the bilirubin could actually cross the blood-brain barrier and cause damage to the brain. So diagnosis, you do a testing for the baby's blood and the mother's blood. Okay, fetal blood typing, direct Holmes test, hemoglobin and bilirubin levels, and peripheral smears. Okay, take it out. So management: prenatal, you can give rhesus immunoglobulin, okay, serial ultrasound and Doppler studies to monitor the baby's anemia. There's sometimes, even when the baby is still in the womb, you can do transfusions. So after the baby is born, you do phototherapy to take care of the high levels of bilirubin, then exchange blood transfusion where you are basically trying to reduce the antibody coated red blood cells.